We are here talking about from challenges to champions, looking at sickle cell disease and how we can overcome and defeat this disease that is plaguing the African American community. And I'm excited to be sitting here with the sickle cell disease advocate, Miss Tiana Wolford. How are you?
I'm doing well. Thank you for having me.
Now, I always like to start out with what makes this issue very personal, and I want to know more about your journey. Tell us about your experience as a sickle cell warrior. We're going to use that terminology, and what led you to start your foundation, the Sickle Cell Reproductive Health Education Directive.
Oh, thank you for the question. So, what makes it so personal for me is that I am living and thriving with sickle cell. I have genotype SS.
You're going to have to break that. You have to break that one down. Go ahead.
Yeah, so there's different genotypes of sickle cell disease, and I have SS, which historically they used to say that that was like the most severe type of sickle cell, but we know that the most severe type of sickle cell is just whenever you're sick. So I have SS, and I was diagnosed through newborn screening, so we knew pretty early. My mother, she knew that she had the trait, but my father swore up and down that he didn't have it. He hadn't been tested, and that's not something that's uncommon. So growing up, I would always kind of compare myself to the other children that I saw in my hematology clinic, and they always just looked like they were in so much pain to me, and I really didn't have a lot of pain, so I thought that I had kind of like defeated sickle cell, like I was invincible or whatever. But I actually was hospitalized at least once, if not twice a year, with something called acute chest syndrome, which is like vagal occlusion in the lungs, and it can be really deadly. So I did have that, and then things really started spiraling out of control for me when I hit puberty. I started having a lot of pain episodes, and by the time I was 15, I had both of my hips replaced, and I was in the hospital like once every 2 weeks. I missed like 80% of my junior year of high school, 60% of my senior year of high school, and I actually ended up having a bone marrow transplant. But it wasn't like the traditional bone marrow transplant. My mother was my donor, so she was only a half match. And I knew that there was like chemo and radiation at the time that was involved. So I went into my consultation and I was like, I'll risk anything to be cured from sickle cell, but I don't want to be infertile. I've always wanted 6 children. And the doctor was like, well, I was 19 at the time. He's like, well, to be honest, with all the complications, you're probably already infertile and you just didn't know. And that was the first time that anybody had kind of mentioned a correlation between sickle cell and fertility, which, you know, as I've evolved over time, it makes sense because anywhere that there's blood flow, there can be damage. So the ovaries are included in that. But, you know, I hadn't had any type of testing for him to say that to me. So fast forward to like 3 years ago, I remember seeing a new adult hematologist, and this is long. I'm trying to.
I want you to don't feel like you're going too long because there are many people watching this, young people especially, that are probably in school, don't know how to cope, don't know what to do. I had never even thought about the fertility issue, that comes along with that. So I'm learning, but those who need to hear this, who may feel like I'm just done with this, like why, they are getting strength from hearing your warrior story. So go ahead.
Okay, thank you. So it's interesting that you said that about the kids who are maybe in school because delayed puberty, that's also a complication. It can be a complication, and that's incredibly isolating when you don't look like everybody else when you're in that locker room. So there's a lot of like reproductive implications that we don't necessarily think about. But fertility for me, that's really my sore spot. And so, after 10 years of having chemotherapy, 10 years later from having chemotherapy, that's when I finally got my anti-malarian hormones tested and all of that. And my hematologist called me and she was like, it's worse than I thought. If you want children, we have to freeze your eggs like tomorrow. And so I did the same Google search that I had done 10 years prior when I was getting my transplant, and there was still like no resources for fertility preservation if you had sickle cell. A lot for cancer, but nothing for sickle cell. And so I just had this idea, like, I'll start my own foundation. We'll give away grants to help with fertility preservation, because it's not even just if you're having transplants. There's other things that could impact your fertility with sickle cell disease. And then talking to that hematologist, she was like, well, yeah, but you need to add like an advocacy arm to that because we need to get like Medicare, Medicaid to cover fertility services. Because over 50% of individuals impacted by sickle cell are on Medicaid. And then speaking with Dr. Smith Whitley, she's like, I think this is great, but we need to do more than just address fertility. There's like lack of access to care for pregnant women because there's no therapy that's been tested safe for pregnancy or breastfeeding. There's some reproductive issues that the guys go through called priapism, which can lead to like erectile dysfunction. So we expanded and became the first and only sickle cell nonprofit in the world to have a mission around reproductive and maternal health.
Okay, you are the first. So I'm uber excited, but I'm also uber upset that. And how long? What year did you start this?
2020.
So during COVID, when we are all trying to figure out how to survive, how to thrive, you are working, doing this advocacy work in a space that no one has really done, thinking about fertility and sickle cell and how you can, like, how was that process for you?
You know, I think that starting during the height of the pandemic actually helped me because I was just in the house bored. So I just needed something to occupy my time. But what was really striking to me, you know, I didn't know how it was going to be received by the sickle cell community. But as soon as we launched, just so many warriors and caregivers that I never even heard of. They were like, look, I never share my story, but what you're doing really resonates with me. And so we've had a lot of impact in a really short time. We were able to partner with Be the Match. So now there is funding for warriors before they get transplants. And we've already helped 16 people in 1 year. So it's going well.
So what is your hopes? Like what is the plan that you really want, you know, even short term? Like what are you working on right now?
Well, I'm knee deep in conference planning. So in April 18th through the 21st in 2024, right here in DC, we're having our conference. And so I'm trying to get a big turnout for that. We're literally making history. And I think like long term, I hope that anyone with sickle cell who wants it can have access to fertility preservation. And then we also know that for pregnant women, the maternal mortality rates are 26 times higher than the national average. And so we really want to kind of buckle down and see what we can do to get those rates down.
What has been some of the reaction from women in this space, even men in this space who are like you are a true godsend?
Yeah, it's really overwhelming because there's this unique parallel with my personal and professional life. So like literally as I'm helping to launch this fertility preservation grant, I'm finding out that I probably can't ever have biological children. And so, but the community is what keeps me going. I'll get mothers who are like, can you come meet my daughter? I want her to see what it's like to, you know, do something that you're passionate about and thrive with this disease. And I've had a lot of women, you know, we launched like a preconception and pregnancy course to tell me that their anxiety has lessened because of the courses. And we've had guys who have like suicidal thoughts over priapism, which is like this painful, long-lasting erection. And it's really embarrassing for them. And, you know, we've just worked really hard to kind of take the stigma and the shame out of some of these issues.
I'm like just feeling so rich by what you're talking about, and especially in this area of fertility. I sit the older woman dealing with fertility issues myself. And so I have had to kind of redefine what I think mothering is. And sometimes it wasn't always comforting from people who had kids telling me, right? You're like, you don't know that pain. However, in a way, I've had to realize taking people on and when people bring their kids to you, there is a mothering aspect to that. So I just want to say thank you. Like, your story is encouraging to me. Lastly, what is it that parents need to know that to get in control of their own care in this area, even testing, because I've known so many people that didn't find out till later, right? So how do we get control of that, and how do we begin to advocate for ourselves?
That's a really good question. I appreciate that. As far as testing, yeah, I think that one of our biggest values is like informed decision making. So I don't want anybody to have a child with sickle cell by surprise, you know? And so knowing your trait status, that's really important. And I think I hear from a lot of providers that they're really focused on like the pain and protecting the organs. And so they don't always have time to bring up reproductive health. And I'm like, the ovaries is an organ though. So you have to, what I really want the caregivers to do is prioritize this, like show up to your appointments and ask about it on your own.
Thank you so much, Tiana. Where can people go to get more information, to find out more about the conference, and to better inform themselves?
Yeah, so we have a really good website that I'm proud of. It's www.sicklecellred.org.
Thank you so much for all the work that you do in the community, and for being, you're like my personal warrior champion too now. Thank you so much.